Hello friends, I am Dr. Vipul Gupta, a practicing cardiodiabetologist in West Delhi. I have been in practice for last 3 decades looking after patients of heart diseases, diabetes and other metabolic diseases. अगर हम बात करें कि डायबिटीज़ के बारे में स्पेसिफिकली आज और उसकी कॉम्प्लिकेशंस के बारे में और उससे जुड़े हार्ट अटैक और हार्ट की संबंधित बीमारियों के बारे में, so I would like to reiterate that diabetes is a chronic disease. Whatever you might do, it keeps on deteriorating and affecting your organs if the blood sugars are not under control. And out of these complications, heart is one of the organs amongst many like kidney, eye and brain, which is affected very commonly in patients who have uncontrolled diabetes. अगर डायबिटीज और ब्लड शुगर लेवल्स कंट्रोल में नहीं है तो हार्ट के ऊपर जो उसकी अंदर की धमनियां हैं उनके अंदर प्लाक्स जमा होने शुरू हो जाते हैं, which makes the arteries narrow. And once the arteries are narrow, the blood supply to the heart and the brain becomes less, and it leads on to heart attacks and stroke. Another complication of heart attack and long-standing diabetes is heart failure, which could be because of low pumping of the heart and the whole of the body doesn't get the adequate blood supply, and it in turn affects the kidneys and the other organs as well. What is more important is to prevent all this. Once you have diabetes, you have to look after once the blood sugar levels and the other associated risk factors like dyslipidemia or high lipid or cholesterol levels, blood pressure and obesity. Obesity also is one of the factors which complicates and aggravates all these complications and which is now known as the mother or the crux or the reason behind so many other complications. The most important to look after is to check your blood sugar levels. Unless until you are checking your blood sugar levels, you do not know which way you are heading and you cannot titrate your levels or your medications. Foremost in control of diabetes would be lifestyle medication, where you do a regular exercise, maybe 150 minutes per week, along with some resistance exercises or some gymming. You should keep talking about your diet. You should take a healthy diet which is low in carbohydrate, rich in protein, low in monounsaturated fatty acid, rich in fibers. You should try to quit smoking and take moderate amount of alcohol. Once you have taken care of your lifestyle modification, you should tackle all other risk factors like cholesterol levels, hypertension and dyslipidemia and obesity. And once you are checking your blood sugar levels, checking the heart health also becomes very important. Regular checking of heart health may be by an ECG or a stress echocardiogram or a coronary artery calcium score becomes very important. It is very important to catch these complications at an earlier stage. So long, unless until you catch them in an earlier stage, they become very advanced and you land up in heart attacks or heart failure, which gives a protracted course and makes your life very difficult, and this in turn gives you a bad ill health in a longer term. So best way to protect your heart would be to keep your diabetes under check, keep giving regular checks in terms of ECG, treadmill, stress echo, coronary artery calcium scores, and be little vigilant in all these complications and other complications as well, the kidney, brain and the nerves, which are very important. And once your heart is healthy, you live a healthier and longer, healthier life. Thank you.